Hypertension is when your blood pressure, or the blood flowing through your blood vessels, is too high. The reason that that's important to manage is because when patients have high blood pressure over a long period of time, it puts them at much higher risk for heart attack and stroke. There's about 1 in 3 Americans that have high blood pressure, and about half of those do not have their blood pressure controlled. So that's putting a lot of our population at high risk. Recent evidence suggests that a normal blood pressure is ideally less than 120/80. We tend to go with less than 130/80 because a systolic blood pressure with the top number of 120 to 130 is still considered within a normal range. Systolic blood pressure, which can be confusing, is the top number, and that's when the blood pressure is flowing through the vessels after the heart is pumping. The diastolic blood pressure, or the bottom number, is when the heart is at rest in between beats. We tend to focus more on the systolic blood pressure because that correlates more with your risk of heart attack and stroke. People most at risk for developing hypertension include African Americans, people of advanced age, postmenopausal women, patients with poor dietary habits including excess alcohol consumption, and patients with certain medical conditions like diabetes and advanced kidney disease. Smokers are also at high risk. The tricky part about hypertension is that most people don't have symptoms. Hypertension has been coined the silent killer. People that do have symptoms tend to experience things like chest discomfort, shortness of breath, headache, visual changes, or they might have a pounding sensation in their chest, neck, or face. There's so many patients walking around undiagnosed with hypertension, and the key to getting diagnosed is screening. I strongly encourage everyone to make sure they're seeing their primary care physician, nurse practitioner, or physician's assistant annually for their wellness exam. Other ways to get screened include places like health fairs or wellness clinics. Making healthy lifestyle changes is the most important thing that you can do to help get control of your blood pressure. Getting active. The American Heart Association recommends about 150 minutes a week of moderate physical activity. Other things that you can do would include quitting smoking, stress reduction through meditation, yoga, breathing exercises, getting enough sleep, which a lot of us have a challenge doing, but 7 to 9 hours of sleep for an adult is recommended. And then, if you have concomitant medical conditions such as diabetes, obesity, or sleep apnea, getting those treated is also really important. Most patients with hypertension or high blood pressure do not need to see a specialist. Primary care physicians, nurse practitioners, and physician's assistants are highly trained professionals that can manage high blood pressure. We typically recommend that if a patient's blood pressure is greater than 180/120 and they're having symptoms like chest discomfort, shortness of breath, headache, or visual changes, that they seek emergency medical care. If a patient has a blood pressure of greater than 180/120 and they're not having symptoms, you probably don't need to be seen in the emergency department, but you should discuss things with your primary care provider as soon as possible.